Greetings. I'm Dr. Steve Tashiro. Thank you for requesting this DVD. I'm a board-certified chiropractor with 40 years of experience working in the healthcare field. And during that time, I've had the privilege of helping thousands of people recover from chronic health conditions. Today, we'll be sharing life-changing information about knee pain. Is it frustrating and embarrassing to you that even though you feel pretty good mentally, your knee pain keeps you from walking even short distances, playing with your kids or your grandkids, and enjoying recreational activities like hiking, golfing, skiing, or dancing? If it is, take heart, because today I'm going to share information about how we can beat knee pain without drugs, shots, or surgery with a three-pronged approach, incorporating the structural, neurological, and metabolic sides of your health. First, let's talk about the structural side of knee health. Let's talk about the actual physical structure of your knee joint. Your knee joint consists of three primary bones: the femur or thigh bone, and the two lower leg bones, the tibia and the fibula. And this is what they look like. The upper bone of the joint is the femur, and the tibia and the fibula are the lower bones of the joint. This would be the front view of the right leg. So this is the outside and this is the inside. In addition to these three bones, there's a fourth bone called the patella or the kneecap. And the kneecap sits on the lower surface of the femur, and as you bend and straighten the leg, the kneecap glides up and down like this. In order to have a healthy functioning knee joint, it's important that these bony structures be in good alignment. In addition to the bony structures, there are soft tissues, and healthy knee function requires that these soft tissues be in a good state of health. The first one I want to talk about is the meniscus. And that is a fibrocartilage. It's like a pad, a shock-absorbing pad. It is present between the femur and the tibia, right in here. This is very much like the discs that separate the vertebra of the spine. And both the spinal disc as well as the meniscus protects the bony surfaces from the impact imparted by walking, running, the normal activities of daily living. As this meniscus pad thins, then, if it thins enough, you can get bone surface rubbing on bone surface. And that's what we call osteoarthritis or bone-on-bone arthritis. And that, as you can imagine, is very painful. In addition to the meniscus, there are ligaments that provide stabilization for the joint. Now, ligaments attach from one bone to another bone, and they're the primary stabilizers of the joint. And we have these ligaments on the inside of the knee, the outside of the knee, the back of the knee, and the front of the knee. Now, while the ligaments provide the primary stability, secondary stabilization of the joint comes from muscles. And in order to have healthy knee function, it's important that these muscles be strong and able to stabilize the joint. So let me show you the muscles in the front of the knee. So this is looking at the front of the right leg. This diagonally muscle is called the sartorius. It attaches to the inside of the knee and the front of the hip. And then a muscle you've probably heard about, the quad muscle. There's three divisions. There's the middle part, the outside part, and the inside part. So these muscles are very important for stabilizing the knee. Then on the back of the knee, we have the hamstring, that's between the butt muscle and the knee, and also below the knee, the calf muscle. Now the tendons from the hamstring crosses the knee joint, and the tendons from the calf muscle also cross the knee joint. So the strength and tone of these muscles is very important and has a large effect on the stability of the knee. In addition, there's a smaller muscle that crosses diagonally along the back of the knee joint called the popliteus. And that's a very, very important muscle because if it's functioning properly, it allows the knee joint to unlock when you move. So as part of the knee evaluation, we test the strength of these muscles to make sure they're functioning properly and doing their job in stabilizing the knee joint. So how do we know if you have a misalignment of the knee joint because of weakness of these muscles and these ligaments? And how do we know if you have bone-on-bone arthritis due to a thinning of that cartilage in the joint? The way we know is by X-ray. So here's an example of an X-ray of a patient that has been receiving treatment in our office. This was the X-ray we took on the first visit when we did the evaluation. And you can see how the joint space on the inside is extremely compressed compared to the joint space on the outside. And this is what we refer to as bone-on-bone arthritis. And you can also tell how this upper bone, the femur, has shifted to the right or to the inside. These lines mark the outside and inside margins of the femur and the tibia, and ideally these would line up vertically. But as you can see in this X-ray, the femur has shifted quite measurably to the right or to the inside. We see that very commonly, that the femur will tend to shift to the inside compared to the tibia, especially when you have bone-on-bone arthritis. So that covers the structure of the knee joint. Now let's talk about the second major aspect of knee joint health, and that is neurological. This is the one that's almost always overlooked. When you have knee pain, this is how the pain signal works. Pain signal travels from your knee up a very small nerve fiber called a pain nerve to your spinal cord. The signal then crosses over to the other side of the spinal cord and then up your spinal cord to your brain. When it gets to your brain, an area called the parietal lobe, that's when you know you have pain. So if we can block that signal before it gets to the brain, we can block your pain, decrease your pain. Well, fortunately, in a state of health, your body has inbuilt systems that do just that. And one such system consists of big, thick nerves called large diameter afferents. And their signals travel at 270 miles an hour into the spinal cord, where they block the pain signals coming into the spinal cord from the knee. However, with aging and certain conditions, such as diabetes, these nerves become unhealthy. They become less efficient in blocking those pain signals, and you therefore become more susceptible to pain. When we do the knee pain evaluation, we test the health and function of these nerves to see if they're doing their job. Now, another aspect of neurological health relates to the function of your brain. In the state of health, your brain creates electrical signals that travel down various highways or pathways in the spinal cord to that area of the spinal cord where the pain signal arrives from the knee. And so if your brain signals are flowing in a healthy fashion, they also will block those pain signals coming into the spinal cord. So in your evaluation, we do function tests to determine if those pathways are functioning properly. Now, mind you, we're not looking for structural tissue changes in your brain like a tumor or an aneurysm. We're looking primarily for a loss of electrical vitality of the neurons, which create these pain-inhibiting signals. And finally, The third prong of health relates to the metabolic or body chemistry side. Our main concern with respect to metabolic health is what we call inflammation. And the best way to describe inflammation is it's a fire that destroys tissues. So like this blowtorch, this is potentially very destructive. If I held this against cartilage or bone, tendons, or ligaments, it would singe and destroy those tissues. So inflammation in your body is like termites in your house. It can be subtle and unseen, or very obvious and dramatic in its effect. Ultimately, though, inflammation damages and destroys your tissue. So it's essential that we curb inflammation quickly. That's the aspect of pain that creates the swelling and the burning sensation. To accomplish this, we use natural, non-toxic, anti-inflammatory herbs, nutraceuticals, and topical remedies. In addition to these, we have a number of remedies in the form of therapies that we use in the office that are very powerful and very effective and very well documented through the scientific research in their effectiveness in decreasing inflammation. And these include cold laser therapy, infrared light therapy, and others. Now, let's look at the x-ray that we took of that same patient following a series of visits in our office. When you look at this x-ray, and again it's the right knee, you can see how the joint space on the inside of the knee is significantly increased. Compare the x-ray we took before treatment and then the x-ray following treatment. There's a significant improvement there. So how did we accomplish that? Well, we used a very specialized computerized therapy called non-surgical knee decompression. And this incorporates the use of a computerized table that allows us to focus on the joint and open the joint in a rhythmic fashion. A session on the decompression table takes 10 or 12 minutes, and during that whole time, the knee joint is actually opening rhythmically and then closing. And when the joint opens, it creates a vacuum inside the joint that sucks water and nutrients into the space that can help heal the cartilage. Like all of our procedures, this is totally safe and very comfortable. It's a very controlled amount of force, and oftentimes people even fall asleep while they're on the table. In addition, we used manual adjustments to improve the alignment of the joint and exercises to strengthen those muscles that stabilize the joint so the alignment can be maintained. Now, for this patient, we also use specialized therapies that improve the function of those nerves that I talked about that help block pain. And we use individualized exercises to boost the vitality of this patient's brain. We call that brain-based therapy. In fact, I want to share with you what this patient had to say following his care in our office. This is what Basilio, the patient whose x-rays we've been looking at, had to say about his experience in our office. I've had knee pain in my right knee for 53 years, since 1960. Even though my orthopedist removed a bone spur, I still had lots of pain when I put weight on the knee. The knee was also crooked. After beginning care with Dr. Tashiro 3 months ago, I can now walk without pain and limping. The bones don't grind, and the knee even straightened out. I have a new outlook on life and can still enjoy playing golf with my children. To summarize, the way we are able to obtain outstanding results like this is with a comprehensive approach that incorporates the structural, neurologic, and metabolic sides of care. If you support just one or even two of these areas, but not the third, your results might be okay or even good. But as a doctor, I don't want okay, I want great results. And that's what my patients want. And great results occur in this area, in the sweet spot, when we incorporate all three of these aspects of care. If you like what you've seen and heard, then I encourage you to take action. I've shared information with you, and they say that knowledge is power, but that's not really true. Knowledge without action doesn't change anything in your life. It's knowledge with action that can change your life. So I urge you to act on our 2-visit knee pain solution offer. And this is what it consists of. On visit 1, I do a thorough evaluation of the structural, neurologic, and metabolic aspects of your knee, including x-rays. And then, at visit 2, I review the findings with you and give you my best recommendation for care, how we can improve your knee pain, knee health, without drugs, shots, or surgery. And then here's the offer. Normally, these 2 visits are $250, but if you're one of the first 15 callers who respond to this offer, it's only $27. Quite a savings. So to act on this offer, call our office at 303-985-5540 and schedule your knee pain solution evaluation. So thank you for taking the time to review this DVD. I look forward to meeting you and improving the quality of your life.